In late 2008, I was having a considerable amount of lower back pain. So I decided to finally go see my doctor. And when I went and saw my doctor, he had prescribed a bunch of pain medications, told me that I needed to lose some weight and get some more exercise, and he sent me on. Over the course of the next 6 months, my back pain didn't get any better. So at that point, my doctor decided that he wanted to send me to a pain management specialist. Right before they did a procedure on my spine to reduce the pain that was in my back, they ran a routine blood test and noticed that my white blood count was off the chart. So they immediately admitted me into the hospital, and over the course of the next 10 days, I had multiple tests to determine exactly what was going on, because the doctors did not know exactly why I was in so much pain. They had assumed that it was most likely an old football injury, a bulging disc, something along those lines. Come to find out, it was stage 3 testicular cancer that had spread into my lungs, my liver, and my kidneys. There was a tumor on the outside of my kidneys that was squeezing on my spine and therefore causing the back pain. Less than 12 hours after I got diagnosed, I started chemotherapy, and I spent the next 4 months going through my chemotherapy treatments, and the majority of that time I was in the hospital because I had reactions so severe to the medications that I was not able to eat or drink anything for about 8 or 9 days, and I ended up losing about 65 pounds of weight, all of my hair, and I was nauseous for the better part of those 4 months, which is a common side effect that a lot of people have. Luckily, after I finished up my treatment, everything was clear. I had my surgery to remove the testicle that had the cancer in it, and everything came back clean after that. It was almost 5 years ago since I went through all of my cancer treatments, and I've been in remission ever since. The good thing is that it really kind of turned my life around, because I was able to take something that was a horrible experience and be able to turn that around and try to help spread awareness about testicular cancer, because it's the most common cancer in males ages 15 to 35, but it has a 99% survival rate if it's detected early. I did not know when I was diagnosed that testicular cancer could be so easily found by a monthly self-exam in the shower. And if you do find something, cancer is not necessarily a death sentence. And that is one thing that my family really helped me with when I was going through all of my treatments and my initial diagnosis, was to keep a positive attitude. And that would be my advice to anyone who is newly diagnosed, is to try to keep a good attitude about it, because, yeah, I'm not gonna lie, chemotherapy is horrible. It's not something I would wish upon my worst enemy, but you can get through it. Chemotherapy is, a blink of an eye in your lifetime, and if you can keep that positive attitude and just, get through that one day, just get through this next treatment, then you'll be fine. There are many, many young men who have had testicular cancer who go on to live very fulfilling lives afterwards. Some men, like myself, they go out and they talk about it and they try to spread education and awareness. Other men, they don't talk about it a whole lot, but they do have a fulfilling life afterwards.